Thank you very much for the opportunity to present this paper. This is my disclosure information right here. The only one that's relevant is that, like Dr. O, I was an investigator for multiple clinical trials sponsored by SI Bone, and I'm currently a consultant. So I think it's generally well accepted that the sacroiliac joint can serve as a source of axial and extremity pain. And the prevalence of SI joint-mediated pain has been estimated to be as high as 30% or even higher in certain patient populations, like those who have undergone previous lumbar fusion. Unfortunately, the efficacies of various non-operative treatments haven't really been well established. And open SI joint fusions, while they are still performed, they're associated with pretty significant morbidity, and the results are really mixed for this particular condition. So minimally invasive SI joint fusion has been introduced, which is intended to avoid the inherent disadvantages of an open surgical procedure. And at this point, there's been extensive clinical experience with over 50,000 of these procedures being performed in the United States alone. And they really account for the vast majority of SI joint fusions that are being performed at this point. Now, generally, these systems involve the percutaneous placement of implants across the sacroiliac joint under fluoroscopic guidance. And this truly is a minimally invasive procedure. It's done through an incision. It's probably a few centimeters long, takes less than an hour, and generally patients are discharged home the same day. So we previously published the 2-year results of a prospective randomized controlled trial comparing SI joint fusion to non-surgical management. And what we found is that minimally invasive SI joint fusion with triangular titanium implants did give rise to superior clinical outcomes compared to non-surgical management. These benefits were present both at 2 years, and now we've also shown that they're present at 5 years as well. However, this study was performed with the initial iFuse implant, which was a solid titanium implant. Now there is a 3D printed triangular titanium implant that allows for bone formation both in and on the surface, as well as actually through the implant. And this porous surface mimics the microarchitecture of cancellous bone. And when you insert it, it actually kind of self-harvests autograft within the pelvis, although you can also pack bone graft material in it as well. So again, this slide lists the number of prospective clinical trials that have been published. But again, most of these did use the initial implant. The SALLY study was recently conducted, which was really designed to assess the safety and effectiveness of MIS SI joint fusion using these 3D printed triangular titanium implants. And now we have the 2-year results. And we really tried to focus on 3 questions. Are these results equivalent to the antecedent device that we're using previously? Is this procedure associated with improvements in physical function and decreased opioid consumption? And is there potential for earlier radiographic fusion with these 3D printed implants? So again, this was a prospective multi-center evaluation of patients undergoing MIS SI joint fusion with 3D printed triangular titanium implants. There were 51 subjects from 11 sites. And the diagnosis was established by a combination of the history, physical exam, including 3 positive provocative maneuvers, and perhaps most importantly, a favorable response to an image-guided sacroiliac joint block defined by greater than 50% relief. So clinical outcomes were assessed preoperatively and at various time points up to 2 years after surgery. Subjects were given a questionnaire to look at various clinical metrics. They also performed physical function testing, and there was a review of adverse events. Patients underwent a CT scan either at 6 months or 12 months. So these are the baseline characteristics and the operative parameters, which I think are very consistent with my own experience. And the follow-up rate at 2 years was 84%. So this study showed that the use of these 3D printed triangular titanium implants gave rise to rapid and durable improvements, similar to what we saw with the initial device, both in terms of disability, pain, as well as quality of life. And these changes were statistically significant. There were also improvements in function as well, as evidenced by immediate and sustained improvements in terms of the number of patients, the percentage of patients reporting minimal difficulties with activities of daily living, as well as when they actually underwent physical function testing as well. In terms of patient satisfaction, over 90% were satisfied, 80% would have the procedure again. Perhaps most importantly, in this opioid epidemic that we're experiencing in this country, the percentage of patients requiring opioids decreased significantly as well. In terms of the CT findings, there was 100% bony binding to the implant surface and high rates of bridging bone across the sacroiliac joint as well. In terms of safety, the overall incidence of adverse events was relatively low, with a limited number of pelvic and surgery-related adverse events. There were 2 revision procedures, one for a malpositioned implant that was causing L5 nerve root irritation. Another patient underwent revision surgery for worsening SI joint pain following a motor vehicle collision. So the 1-year results of this study were already published, and what they found is that at 1 year, sacroiliac joint fusion with these 3D printed triangular titanium implants resulted in improved pain, disability, and quality of life. There was a suggestion that maybe you do get an earlier bone fusion, and there were also improvements both in physical function as well as opioid consumption. So in conclusion, I think that MIS SI joint fusion using these novel 3D printed implants resulted in immediate, marked, and sustained benefits at 2 years, similar to the antecedent device, as reflected in clinical metrics, physical function, as well as radiographic fusion. There was a low rate of procedure and device-related adverse events, suggesting that this procedure is associated with significant safety and efficacy for this particular condition. Thank you very much.